Hello, my name is Kristin Prelipp, and I'm the Public Information Officer and Communications Manager for the Orange County Health Department. Welcome to the second episode of Public Health Chat. In each episode, we will meet some of the wonderful people who work in public health and will explore a variety of topics. I would like to introduce the participants for our first segment. We are joined today by Orange County Health Director Quintana Stewart, by Dr. Monique Felder, the Superintendent for Orange County Schools, and by Dr. Jim Causby, the Interim Superintendent for Chapel Hill Carrboro City Schools. Quintana, first, if you would, please give us a COVID-19 update for Orange County, North Carolina.
Sure. So as of today, November 11th, 2020, North Carolina has 300,561 lab-confirmed cases of COVID-19. There have been a total of 4,698 deaths across the state. Here in Orange County, we have a total of 3,350 confirmed COVID cases, and unfortunately, we've had 59 deaths related to COVID. Over the past 7 days, we've had 159 new cases. This means we're averaging about 23 new cases each day. Case count is one of the 4 metrics we monitor to learn about virus transmission in the community. This number is steadily increasing here in Orange County. Our case investigation shows that most of our new cases are the result of social, community, and family gatherings. It is imperative that we remember the 3 W's. We must wear the mask, wait 6 feet apart, and wash our hands often. We need to do this out in public and in any social gatherings that include individuals outside of our household members. Yesterday, Governor Cooper announced that North Carolina will remain in phase 3 for 4 more weeks. He also announced that beginning this Friday, the indoor mass gathering limit will drop to 10. This is an effort to suppress virus spread during this upcoming holiday when folks are likely to gather indoors for a Thanksgiving meal. The other 3 metrics we monitor include COVID-like related emergency department visits. We've seen a slight decrease over the past few weeks in this category. We also look at percent positive tests. Again, this is the number of positive test results we get from all the tests conducted here in the county. We are maintaining at about a 3% positive rate. This is good. The goal is 5% or less. So each week we continue to increase our testing. And so to maintain that 3% positive rate is a really good thing. To date, here in Orange County, we ran about 72,500 tests, and again, the number is growing daily. We also monitor the number of hospitalizations. We are seeing a slight increase in the number of COVID cases that are being hospitalized. This is an important number to watch because we don't want to overwhelm the healthcare system. So as we enter into the cold and flu season, I just want to take a moment to encourage anyone who has not yet received your flu shot to please do so. Anything we can do to suppress demand and the needs of our hospital healthcare system would be great. So we don't want to compile the COVID response with a flu response if we have a way to prevent that. At this time, we continue to have adequate staffing for our case investigation and contact tracing, and our personal protective equipment is stable.
Now we're going to discuss K through 12 public schools, since we know they may impact many residents of Orange County. Here in Orange County, we have 2 public school systems, Chapel Hill Carrboro City Schools and Orange County Schools. NCDHHS, in consultation with the State Board of Education and Department of Public Instruction, issued guidance for schools this past summer. Schools were asked to plan for reopening under 3 scenarios. Plan A, which is minimum social distancing, Plan B, which is moderate social distancing, and Plan C, which is remote learning only. Both school systems have been operating under Plan C, remote learning only, since March, but are slowly and carefully transitioning into Plan B. I think community members would be very interested to learn more about the decision-making process as you both shift from Plan C to Plan B, which is moderate social distancing. Dr. Causby and Dr. Felder, would you explain to us what is the ABC Science Collaborative and what role do they play in your decision-making?
That's a great question, Kristin. Early on, my Board of Education, Chapel of Carrboro, felt like we needed some medical advice and looking at the metrics to help make decisions when we would close, when we would open. Basically keep our decisions based on science as much as possible. And so we made some contacts, and turned out there was a group from Duke University Medical School that was very interested in doing this kind of work and was actually looking at a National Institute of Health grant to help fund it. And they were able to get that. And they entered into cooperation with some similar staff members from UNC Chapel Hill School of Medicine and put together this group. And there were initially 4 pilot systems that were involved. Chapel of Carrboro City Schools and Orange County were the first 2. We were later joined by Durham County Schools and Wake County Schools. And basically what they do is they give us guidance. They work to keep us abreast of what the latest studies were showing is happening with COVID statistics. They're also now spread, and they're working with over 60 systems in North Carolina. And they've been really looking closely at the systems that are back in operation under Plan B and sharing with the rest of us who are not what kind of experiences and procedures those school systems have put in place.
Yeah, I was just going to add that, so, you know, as public educators, we are not health and safety experts. And so the resources that the ABC Science Collaborative has provided us and our families has been significant. You know, as we continue to bring back small groups of students to school, the ABC Science Collaborative has been instrumental partner in with regard to our safety protocols. Not just what we do, but knowing what not to do. So we've learned a lot from them with regards to, you know, lessons from other school districts, particularly those who have been in Plan B, some since August 17th. So there's lots of lessons learned. And so, you know, for example, you know, when I think back to when this pandemic first began, I think back to how I had to provide staff with letters so that they could drive to the office and not get pulled over or get a ticket. I think about how, you know, far we've come with regards to what we know now that we didn't know then. I remember when I washed my fruit, I left my shoes outside. And so, you know, what we know now about COVID-19 continues to evolve, and they are helping to keep us on the forefront of the science around COVID-19. So they are just one partner we rely on. We have worked very closely, and we continue to work very closely. I feel like we're joined at the hip with the Orange County Health Department, and we've done that since day one. Again, as public educators, we have always embraced collaboration and partnerships. The pandemic requires us to have health experts at the table as we make decisions to return to school and ensure that we are keeping our students and staff and the community safe.
Thank you. So you kind of answered my second question, but I'll go ahead and ask it. So are you in contact with superintendents from districts that have been back in school? It sounds like yes. But do you have any lessons learned from other superintendents with districts that have been back in school?
Oh, absolutely. We have, Orange County Schools has been in close contact with a number of districts right here in North Carolina. As Dr. Causby mentioned, there are a number of school districts, I believe 50 or so, that have been in Plan B since the beginning of the school year. And so, you know, when we first got into this pandemic, you know, there was no roadmap, no blueprint. It was new to all of us. And so it's helpful now to have districts who have gone before us. We have visited Hudson County. They were kind enough to allow us to visit with them. We learned lessons around the strict adherence to the 3 Ws and the difference that can make. We learned so many strategies from that around how, you know, how they handle things such as children using the bathroom, what their lunch process looks like. We've consulted with, again, schools across North Carolina, but we've also consulted with schools outside of North Carolina. We've learned a lot from actually schools, districts in other countries that have had success with having students back. And a lot of it, while, you know, we know that we're never going to totally mitigate COVID-19, those 3 W's make a huge, huge difference. And so we continue to regularly consult with other districts about specific to, you know, their program areas, and have learned an awful lot as a result of that, and have not encountered one district that has not gone out of their way to share and help us to get ready for Plan B.
We've done similar things with Chapel Carrboro City Schools. Probably the 3 main groups that I've done those kind of meetings with. First is when Department of Public Instruction has meetings with all superintendents and informs us of the latest information, and that gives us a lot of chances to ask questions. Some of the DPI folks also hold office hours that we're able to contact them to get the latest updates. And our school system, the state is divided in 8 educational regions, and all those regions have what's called a RESA, a Regional Educational Service Alliance. And we're involved with 2 of them. We're involved with the Central Carolina RESA, which is the school systems, primarily the Triangle area. And we're also involved with the Triad region, which is most of the school systems in the Triad area, which is around Greensboro, Winston-Salem, those areas. And I meet with both of them almost weekly. And we really go around the room and just share and talk about what we're dealing with and how we're handling different situations. And we do that even between meetings. We'll send questions back and forth, and everyone will respond to them. So that's been a tremendous help. But what's been probably the most interesting part of that is, first of all, listening, as Monique says, to the systems who have been open for a while and how they've handled it. Because they've worked through issues that we're now just facing. Mm-hmm. And I know Monique and I both will listen very closely and ask questions of those folks about how did that work, and would you do it differently now? Was there a better way of doing it? Mm-hmm. And listen to that. A second piece of it has really been so interesting is to listen to the differences in what school systems are dealing with based upon their location. Yeah. Because it's very different to be in Orange County than it is to be in Stokes County, mm-hmm. or somewhere else where the politics are very different, where the education levels are very different, where the concerns are very different. You know, where we early on were dealing with parents who didn't want us to even think about going back in person. These systems were having people march on their offices because they weren't going back in person. So it's very much local, and everyone has dealt with that. But we've learned very much, I think, from the ones that are already back in, that you can successfully do it. Yes. And if you follow the protocols, if you have the mask, if you social distance, if you have the hand washing, if you're very well organized and processes and flows through your buildings and your transportation processes, that you can do it and do it safely. And it's kind of interesting, the information that ABC Science Collaborative is saying is that if, from what they're seeing, the systems have been all open for some period of time, and based upon the cases, there's very little second level transmission within schools, secondary transmission. That most of the cases they have comes in from outside, and if you properly screen folks coming in and out, you catch that very quickly, and then you isolate, quarantine, and you work through that. So most of them are handling very well. It's going to be interesting to watch as cases increase, because we are seeing some systems who've been in B all year are now going back to C, at least for some period of time.
I'm wondering, do you feel any pressure from your community to reopen?
I wouldn't call it pressure. I get a lot of suggestions and a lot of questions, but they come from all different angles, and it really depends upon the specific circumstances of the child and family. For example, we've had a lot of folks want us to get our adapted curriculum, which is our curriculum for our most severely and profoundly handicapped students. They want those children back in school because there are services and types of things that we should be offering that they need. So we're working really hard, and we're looking to bring those students back in early December. That's a priority for us. If it's a young family, for example, that's 2 or 3 young children, both the husband and wife are working, maybe they have relocated in Orange County and they don't have relatives and they don't have anyone to work with the kids. So, they really want us to go back to school. But I say the largest percentage of folks that say to us, remote learning is working pretty well for our family. It's working much better than we thought it would, and we're happy with it. We'd rather stay safe and continue doing that. And our board has insisted, I know Orange County is also, and continuing whatever we do to provide that remote option for our families if they want to continue it.
Yeah, so I agree with Dr. Causby. I'm not feeling pressure. Our families have been great during this pandemic. They have extended a lot of grace and understanding and patience. So if there's pressure to return, it's internal pressure. And why? Because as educators, we know that while remote learning is working for some, I have a grandson who is blossoming, not here in North Carolina, in Maryland. For him, it's the greatest thing since sliced bread. He doesn't have to deal with some of the things that he was dealing with in his school, some of the social emotional things he was dealing with. He feels he has greater access to his teachers. He says his teachers are less stressed. So he's blossoming and doing well. But we know that some of our, EC students, exceptional education students, some of the most heavily impacted students, it's not working well for them. It's not working well for some of our youngest learners, and it's not the teachers. It's simply the remote learning aspect of things. And so we know that remote learning as educators is not, there's no substitute for in-person learning, that it's not the best option for all of our students. So this is why we have been creative, and we've been bringing back small groups safely since August. Currently, we have 2 supervised learning labs open for students. And these are students with working families, and we've done that since August. One is in partnership with the YMCA. Another is one that we run on our own. We, in October, brought back EC separate settings students, those who want to return to remote learning, as well as our pre-K students. And so far, that's going very well. We have small groups of students coming back. So schools have, the board gave the option to schools to bring back small groups of students, and some of our schools have already begun to do that, some for one day or one-time events, others for on a more consistent basis. So students are coming back for chemistry labs, robotics, CTE classes, and we will have an opportunity for more students to return in person learning in January. So that's what we're gearing up to for now. We are working hard to return to class slowly and safely. We are not cutting any corners, and are always taking the highest threshold around safety that we possibly can. That's been our plan, going slow, doing some piloting within, learning from other districts, hugging tight to the Orange County Health Department, as well as to the ABC Science Collaborative.
Thank you. My final question, what steps are you taking to ease the concerns of staff and families regarding an eventual return to school?
Yeah, great question. These are all great questions. So one of the things that we're doing, we're facilitating information sessions. We had one last night with almost 300 families participating. We have a series of other ones lined up. And so these are information sessions for families about the academic program offerings, as Dr. Causby mentioned. And I believe, and Dr. Causby, you can correct me if I'm wrong, every school district is required to have 100% virtual option. But we will, in Plan B, it is hybrid. So it's on an alternating basis of in-person and remote. We have a number of virtual, what we call virtual academy, which is 100% remote. These are for families and students who have decided they're not coming back in person, at least for not for this school year. And so we're providing information about that, safety protocols. We have information sessions around that. And the science to support safely returning. So we've done that. We've set up a web page focused solely on Plan B, both from the instructional side of it, as well as the safety and health measures and protocols that we have in place. The ABC Science Collaborative has been instrumental in the science behind COVID and helping to educate our community about that. And as previously mentioned, we have safely brought back students and staff since August. And this has been instrumental in easing families and staff concerns. The 3 W's, I don't know what else to say about that, other than, that's what we are strictly adhering to. And we've also developed a COVID metrics monitoring task force to help guide us on our return to school, particularly when we're in Plan C. In Plan B, we will pause their work because the decisions we have to make in Plan B will be more moment by moment, scenario by scenario, and highly confidential in terms of what we need to discuss and maintain the confidentiality of students and staff. And so we'll pause the work of the metrics monitoring task force while we're in Plan B. But in Plan C, they've been very, very helpful in helping the district to monitor metrics and make decisions about next steps for our district.
I think the easing of concerns of staff and parents has probably been the most difficult part of this. Because other things you can plan, and you can put your signs and your 6 foot apart stuff, all those, you can do those things. But when people have a fear, it's very difficult to take that away from them. I made a comment one time that it's very hard to webinar away fear, and we're doing a lot of webinars. The ABC Science Collaborative has done a number of those for our staff, and the 4 pilot systems have been very much involved in having staff members watch those. Such things as, what is the value of a mask? How do you wear it? The different types, because there's so much misinformation that they're hearing about what's necessary and what's not. Such things as, how important is ventilation? What is special education and COVID? So they've done a number of those things, and those have been very beneficial. The problem is that they're not as widespread as we'd like for them to be. We'd like for everyone to see them, but I've said all along that the success to bringing staff back successfully and making them feel good is to get them confident. And you only develop that confidence through sharing the information from people who know what they're doing and correcting a lot of misinformation, because this circumstance has been, and I'm not talking partisan politics, but it's gotten so political, and with different kinds of belief systems and people making fun of each other if you wear a mask or if you don't wear a mask, and it's become so personal in some cases, and different interpretations of what you should be doing or what's going to solve this problem, that folks really in some cases don't know what to believe. And I'm pretty well convinced, and I think we found this out from your earlier question of working with other systems, is that you really don't get that confidence with staff or a lot of your parents until they're actually back. And they get into it and they say, yes, this does work. Suddenly everyone's not being infected. So that's our biggest area. I've been working on trying to develop that confidence among folks that yes, it can be done and it can be done safely. And it's not just with everybody. One of the biggest groups to do that with is your Board of Education. These are folks who are wonderful people. They run or devoting a great deal of their life to public service, and they listen to a lot of folks, and they get all kinds of opinions expressed, and they want to make the very best decisions, and they're very torn about what their decisions are. So we try to do a lot of educating there too. And my role as an interim is a little different than what you'd be when you got a 4-year contract like Monique does. It's just a kind of a different relationship. My role is to provide the information and the sharing and the options, and then let the board make the decision.
Well, that's my role too. I do the same thing.
No, you tell them everything you want them to do. I know how it is. But there's a difference in the role between the interim and a full-time superintendent, because I'm going to leave it to somebody else before too long. So, and the board needs to feel comfortable with what they're doing. So that's why it's trying to build confidence and provide information.
If I could just add one more thing, I want to build on something Dr. Causby says that I have found. He's right. The webinars are great there. That's wonderful. Some of our staff have learned through that. We've used FAQs, but in Orange County schools, one of the most important things that has really helped to calm fears is bringing our staff together with staff in districts that have been open. They want to hear from their colleagues. They don't want to hear from me. They don't want to hear from board. They want to hear from their colleagues. They want to hear the truth from their colleagues. And that has made a huge difference. We started by bringing principals together. Our principals with principal from other school districts that have been open. And my goodness, I can sense it. I sensed it in the room. And it was all virtual, but I could still sense that was a game changer. So we're doing that with teacher groups now. We're bringing teachers from our school district together with others, but also the models that we have in our own district where we, have small groups coming back are serving as exemplars for them. Yeah, but it is still a level of fear, and rightfully so. This is still a deadly virus. Let's make no mistake about it. It is, and we can't put our heads in the sand about it. So.
Well, this has been very helpful. Thank you so much to both Dr. Felder and Dr. Causby for your steady leadership during this stressful time.
Well, thank you. Thank you for the opportunity.
Thank you.
Thank you, Quintana, for all the health department does for us.
Absolutely.
Thank you.
Yep, we're glued to the hip. Don't forget
That's
that.
right.
For our next segment, we would like to turn to our Environmental Health Division. Our Environmental Health Division helps to keep Orange County safe and sanitary. Any place that prepares food or drink for the public must get a permit from the health department. Inspectors also visit lodging establishments such as hotels, as well as public amenities like swimming pools, summer camps, and schools, to name a few. Our health inspectors build positive relationships with local businesses and work alongside management to help them stay up to code, which maintains sanitation standards here in Orange County and also prevents foodborne illnesses. I would like to introduce you to the Environmental Health Division Director, Victoria Hudson. We're also joined by Roberto Diaz, one of our wonderful environmental health specialists. Victoria, I invited you all here today for two reasons. First, to tell everyone about the prestigious Bill Broadway Award, which you recently won. For people not in environmental health circles, this award is akin to the James Beard Award for Culinary Professionals or the Pulitzer Prize for Journalism. Quintana, can you tell us more about this award?
Sure. A nominee must be actively engaged in or contributing to the field of environmental health and have performed professional duties in the field of environmental health above and beyond the usual employment requirements. This quote from our Board of Health Chair, Jessica Friga, says it best. Ms. Hudson embodies all the characteristics of a Bill Broadway Award recipient. Her dedication to environmental health is endless, and you can see how much she really enjoys her job. I am amazed at her ability to be such a strong regulator while simultaneously offering wonderful customer service. This is truly a skill that folks in regulatory positions often lack. Our county has been known for having a rigid environmental health division, but Ms. Hudson has a calming way of educating residents about the reason for our rules and practices in an effort to protect their health and safety. During the COVID-19 pandemic response, Ms. Hudson has been a true leader in our community, going above and beyond to educate local restaurateurs and retail stores about the importance of physical distancing, wearing a face covering, and frequent hand hygiene. For months, the environmental health team was our sole group of enforcement and education in the county.
Victoria, during the pandemic, how has the work of Environmental Health Division changed and how has it remained the same?
Well, environmental health had a number of really good business contacts already because of the establishments that we work with normally as part of our workload. And it became very evident early on that one of our largest stakeholders in COVID response, as the governor began to get tighter and tighter controls through executive orders, is that we needed to get ahead of it and make sure that all of our inspected establishments, particularly restaurants and other food service establishments, had an ability to get the education that they need early so that they could make decisions early, so they didn't lose any staff if possible, if they didn't lose any product, and most importantly, that they were already prepared for public health response. So the magic that happened as part of that, as the task force came together, the infrastructure group needed more connections with business through like a liaison type situation. And a lot of the restaurants are in the same proximity as those businesses, and businesses have a very similar structure. And so it was a very easy transition into expanding our base of who we would normally speak to. And now we've made so many other connections with just businesses that weren't part of our inspected group before. And so what is the same? We're still doing education, day in, day out, face-to-face, one-on-one, over and over and over again. It just seems to be amplified as to the amount of education. The content is a little bit different, but we've been teaching people how to wash their hands for decades, but now they're finally starting to listen. So I'm pretty happy about that. And what is also very similar is complaint investigations. Well, we've always had to investigate complaints. This office has always had a policy that we would respond to every complaint, even anonymous ones. And people were very concerned. They're concerned, in March they were concerned, and today they're still concerned. And those concerns and those observations need to be treated with real honesty. People don't normally just call the health department. I've lived my entire life and I've called a health department one time to make a complaint. And it's not something that people normally do frivolously. They have a very serious observation and they want somebody to know about it. And typically speaking, a complaint is usually ending with some sort of comment like, I just wanted somebody to know. Well, we're the people that somebody should be telling. And we don't mind being that capacity. So doing a complaint investigation is what we're used to. Doing the volume of complaint investigations is a little bit different. And we have been very overwhelmed at times, but it's not something that we can't manage, and we can't continue to rely on our staff as we work together to make sure everybody has coverage. And then I think the final way that people communicate with us and we communicate with them, that's the same, is that trust. And so a fellow called me yesterday and he started out by telling me he was 90 years old. And then he started telling me about how he finally decided that he wanted to go out to eat. And he had gone out to eat at a place in the county. And it wasn't until after he had eaten that he decided that he just wanted to call the health department and tell the health department how well they were doing. And I was like, I cannot believe that people would come and call me and tell me what a restaurant would do. And he was 90 years old. So I was like, any other observations you want to make, you don't hesitate to call me, because I think that is fantastic. And so that's what's different and that's what's the same. And I wouldn't change a thing, because we've been preparing for this our entire professional life. And I can't wait to see how it turns out.
Thank you. So I think a good example of how you all work with people and have had to change and adapt to the pandemic would be the Carrboro United Local Food Hub. Roberto, I know you've been integral to this. Can you tell us about your work with the Carrboro United Local Food Hub?
Yes. When the pandemic started back in March, lots of restaurants, they have to close their doors. And then, they have to reinvent themselves in order to maintain their business. And I saw lots of operators, depressed, sad, and it was heartbreaking to me, And so one of the operators, in Carrboro came to me and asked me if they could do something, as far, like the Carrboro hub. And I definitely, told them, to give me in writing their proposal, what they were planning to do. And I gave them input, ideas on how to maintain everything safety, and it was done. It was a success. And I think it made it national news. And I'm very happy that I was part of it, that I was able to help them out, and that people kept their jobs, and lots of these restaurants kept their business going. And like I said, I was happy because, lots of families depends from these jobs, and I was able to help them out, and it, like I say, was a success. Yeah.
So for those that are not familiar with this business model with you, the Food Hub, tell them, what is it?
Yeah, basically, different restaurants, in the community of Carrboro, they came together and they served their food through a system where they rent a large trailer where it was refrigerated, and they the community placed their orders online for different restaurants, and basically people will come out in their cars and will pick up their orders through a line, like just like a drive-through, and everything was safe because the food was kept refrigerated, with instructions to how to reheat the product, and was delivered, in a safe manner. Everyone, wearing masks, and people don't have to be, in line, physically in line. They were in their cars, and they don't have to be in contact with tons of people, like in restaurants, waiting in line to get their food. So it was very safe and very effective.
That's great. Thank you for telling us about that. And thank you for all your work. So I want to ask, with Thanksgiving around the corner, do either of you have recommendations about how to stay safe during the holiday season?
Victoria, you want to start?
You're talking about food safety first. I think Thanksgiving typically is something, that we always get this lesson right before Thanksgiving from various sources. And what I find, just my experience with doing some suspect foodborne illness investigations after the holidays, there's really kind of like two big mistakes people make, and it's not like they make the same mistake. I guess they could, but it's really like this kind of mistake or this kind of mistake. One mistake is that people try to do it too quickly. Like, they don't realize how long it takes to thaw out their turkey and to cook the turkey. And that's something that can't be rushed. Either you buy a turkey that's not frozen, or you buy a turkey that's frozen 3 to 5 days before Thanksgiving, and you put it in the bottom of the fridge and you let it thaw out. And then you can take the 3 hours or 4 hours it takes to cook the turkey. And yes, it takes 20 minutes per pound generally to cook a turkey thoroughly to 165. The second crowd of people are the people who start way too early. Like, they really get started on about Tuesday, and they want to cook all their pies and their desserts, and maybe they even like pre-cook part of the turkey, and they make their dressing, and they really do themselves a disservice because they're improperly cooling those foods. They don't have adequate refrigeration to keep all that food that they've prepared until the date of their meal. And so I think that the big mistakes really happen in either one of these scenarios. And so the other thing I would say is that if you're going to give the gift this Thanksgiving, you need to give the gift of health to your family and friends. And that would be maybe not having a big Thanksgiving meal, or if you have to have a Thanksgiving meal, make sure that you are spread out if you are not members of the same household, and that you give yourself plenty of air and space, maybe eat outside, but sitting directly across from each other at a dining room table and you haven't seen each other in weeks, it's probably not a good thing. And people traveling should quarantine before travel, and they should be prepared to quarantine after travel. So those kinds of gifts are the kinds of gifts that I want people to give themselves for the holidays. What you say, Roberto?
I would say you're on target. Basically, Victoria has said, about time and temperature control over your food, critical control points. One will be, cooking and cooling, right? Right after you cook, chicken, and you're gonna cool food, don't leave food out for more than 4 hours without refrigeration, or reheating to 165. And the other point also when it comes, to personal hygiene, especially during this pandemic, washing your hands and wearing your mask. Only if eating, of course, you're gonna take your mask off, but distance. If you come and visit family, make sure to maintain distance, especially if you have the loved ones who are elderly or have immunocompromised systems. That those are good measures to take.
That's great. Great advice. I have one very important public health question to ask you all before we go. I want to know, what is your favorite thing to eat on Thanksgiving? I will go first. I love the collards. That's a new thing for me because I'm from Wisconsin, but I love collards. Quintana, do you have a favorite?
I do, actually. I think my favorite dish would be sweet potato casserole, and this one my mom makes, and it's covered with the pecan nuts and lots of brown sugar and butter and all that good stuff. So that's my favorite.
How about you, Roberto?
I like the homemade mashed potatoes.
And Victoria?
I like cranberry sauce that's made with real cranberries.
Nice. Yeah, 1 cup of sugar, 1 cup of water. All right. Well, thank you all so much for joining us for this episode of Public Health Chat. Goodbye, everybody.
Bye-bye.
Stay safe.